My name is Joe Touma. I'm an ear, nose, and throat surgeon in Huntington, West Virginia. I specialize in ear-related diseases and surgery. I'm here today to talk about the Google Broadband Fiber and how it's important to us and the medical community. From an educational standpoint, there's a lot of times we like to reach our patients at home, and they would like to reach us here regarding things that we may be talking about with regards to surgery or medical interventions. And oftentimes there are programs that have data in them that we would like to share with them, and if they're not here in the facility, we are unable to do that very effectively. So as you can see in the background here, we have a program that we often use with patients to show them anatomy and surgical intervention, and really an educational experience for the patient to understand what they're going to be going through and what they're going to be experiencing. Furthermore, electronic medical records has been a big aspect in healthcare, and it's really being pushed forward to the point in the next 10 years the majority of practices will be using some form of electronic medical records. Those records are oftentimes data heavy, and in order to access that data from hospitals or outside satellite clinics or your home office, it would be nice to have a high-speed fiber that we could access this data in a very rapid fashion. Imaging studies as well have become much more widely used in practice, not just in our field, but a lot of surgical fields. CT scans, MRIs, PET scans, those are extremely heavily laden in data. And being able to have high-speed access to this these kind of tests would be extremely beneficial. It would also, in part, reduce the number of unnecessary tests for patients. For example, if somebody comes from 2 hours away, has an image that is done somewhere else at an outside facility, we can access that much more readily. All fields of medicine would benefit, not just our field, but all fields in this community. The medical school, the private practitioners, and I think it would help us integrate much better with patient care. I appreciate your time. Thank you.